Hey everybody, and welcome back to the channel. Thanks for joining us again for another episode of The Pit. I guess this is episode 10, which is, my math serves me right, 4 p.m. now. So anyway, I'm Dr. Todd. This is Allycia.
Hello.
And like I said before, thanks for coming back with us. For those that have maybe stuck around and watched a few episodes, if you are new here, thanks for joining us. Consider giving us a like, subscribe, comment, all the above to help us grow. Anyway, I don't want to spend too much time, I guess, talking about the last episode before jumping into this, but real quick, last episode was sort of affectionately termed the crash out episode.
Yes.
Because it was a lot of crash outs. We had Langdon crashing out on Santos. We had the patients crashing out on each other in the waiting room. We had assault and battery at the end of a nurse. So they really brought in some of those, I guess, new interesting elements. A little less sad, thankfully.
Yes.
So,
yeah.
Yeah, no, there were still some sad elements, obviously.
I know.
Sort of
nothing like that little girl.
It's like sort of the hangover effect from that. I know you said that your sister warned you that it gets worse.
No, it was Lucy.
Oh, okay.
Yeah, my cousin.
Okay.
Yeah.
So, Lucy.
She said it gets way worse. So,
Lucy, I doubt it. I really, yeah, I doubt it. We'll see.
I don't know that it can.
Okay. Obviously, I know the saying, right? Like when I said, could it get any worse? I was saying rhetorically, like it wasn't it wasn't a threat or what? I don't know.
I know.
I'm saying that wrong.
You're not challenging the show.
Right.
Yeah, you don't want to challenge them. We don't want it to get worse.
No, we'll see. Maybe the rest of the shift will be easy and it'll be quiet and they'll sit around and share stories from their past, and then they'll all high five on the way out, and then the next season will start with the whole new cast of, say, the next day when the new staff comes on. And so, anyway.
This is why I typically stick to shows that are about like dragons and things that don't feel real.
Yeah.
Fantasy.
Well, hey, this.
But it's a good show.
Yeah, no, obviously it's great. And,
so emotional.
and we'll see what episode 10 brings in store here. Hopefully they rest that guy. I don't know.
It'll be interesting.
I'm curious. I know I just said we're going to get right into it, and then we'll let
you keep talking.
Rambled on for like 5 minutes here. You can skip ahead of the reaction if you want. But I'm curious if some of these like side stories will have like resolution. Right, like I'm curious if I don't know that we will, because like the story is being told through the eyes of the ER, but like will we figure out what happened with the
I don't know, it could
trafficking victim? Will we figure out what happens with this guy who just assaulted the nurse? Will we have, I'm assuming like the kid from what the first episode or second episode when he had made the list, that's probably coming back because the mom is still there. So we'll see what happens there. I hope that doesn't foreshadow how things could get worse. But, all right, Lucy. Anyway, let's jump.
let's do that.
Jump right in. The Pit season 1, episode 10, 4 p.m. Let's get it.
Let's get it.
Yeah, I'm trying this out.
Yeah, that's that. I don't know. I like that.
You know your son is now?
But he hasn't done anything.
Officer, why are you here? Created a list of girls you would like to eliminate.
Who called you? Somebody called you. Who? Somebody from my hospital?
Dr. McKay?
Yeah.
I do not blame her at all.
I know.
Be right back.
This shift got a little more stressful.
Paramedics estimate 90% BSA.
Trauma one's open.
BSA, body surface area.
The first year of an LR running wide open.
What percent did they say?
I think 90%.
Oh, the 90% of his body.
Yeah, that's important. Like quantifying the basically percentage of burn is important for prognosticating and treating.
200-gallon field tank to my tractor.
Let's set up for intubation. Whitaker, run the Parkland formula. And I will be back for the intubation. On it, boss.
What? Oh, that's right. She got hit.
Yeah.
I know we just talked about it.
Did you forget? Oh, God. And so she broke her nose. He broke her nose. And
yeah.
She did not break her nose.
It's an unhappy patient.
A patient hit you? I thought my cheek broken.
I lost a tooth.
Oh, interesting. You've ever been assaulted?
I have not.
Okay, that's good.
I hope never
that is
to be.
Good.
No, LSC, just Just wait out.
Maybe it's just Pittsburgh.
Well, I think just the ER setting, obviously the stakes are a little higher.
On my finger, right?
She makes just as good of a patient as doctors do.
Well, I think that's a common theme.
Forget it.
Look, I want a name.
Mm.
Yeah.
There's gonna be cameras.
Doug Driscoll.
The asshole in chairs. Yeah.
Mm.
Mateo might go over there.
Mm-hmm. Oh, the cops are there, aren't they?
Yeah, but the guy left.
No, he said I'm calling the cops.
Right.
The nasal CT head maxillofacial.
I give them a heads up. They're really necessary.
Did she say is that really necessary?
Okay, who can step up?
Ayokong gawin yan.
Mas what ikaw kaysa ako, no?
You know the difference between surgeons and serial killers? Killers don't bill their victims.
I've not heard that joke before.
Nope, that's interesting.
20 rock uranium, 100 ketamine. Got it. Draw them up in a whole loop.
They're good, but gonna need a pan scan after intubation.
A pan scan?
Pan scan, basically scan head to toe.
Oh, okay. Never heard of that.
It's called stroke.
Maybe it's gone in.
Looks like he's in her 20s. Obvious aphasia, right-sided hemiparesis, and
Stroke in the 20s.
Calls another teammate in Houston who called 911 here.
Who gets a stroke in their 20s?
that's what you...
Yeah.
Okay, come find me after the scan results are back.
Oh, well, that's who he's looking for.
Good vitals, got 4 of morphine on.
I'm fine, by the way.
You know this guy?
Looks trimallear.
He didn't want to be in this shit all I told him to take.
On the curb?
Are you two family?
X.
This is Chad, Harrison's dad.
His name is Chad.
Yeah. And he's probably a really good guy.
I bet it's only spelled with one D.
Yeah, most are.
Yeah. I wonder if there's any others. Oh, is there?
Oh, yeah. What was it?
Wasn't there one that lived in our area?
No.
Same first and last name?
No, but there was a Chad that 2 days that played for the Bearcats a few years back.
Oh, okay.
Chad Moore, I think was.
Where's the last time you took a bath? Where's Robbie?
Intubating the burn patient.
So we're only a few minutes in, and there's already a lot going on. Right? We have
Yeah.
a stroke, code stroke. We have a 90% burn. We have a skateboard injury.
A thrombus that through a clot to the left middle cerebral artery.
Okay, got it. We'll wait. Cranial hemorrhage, she might be a TNK candidate.
TNK cause a brain bleed and killer.
He's still the best clot busting possibility.
Shouldn't we do
It's a
endovascular?
T&K.
Basically a clot busting agent, like so a very potent clot buster. And so the general rule is, I think it's within 4.5 hours of symptom onset, the data supports its use. Yes, if you thin the blood out, there's a risk of bleeding, but significantly improves outcome. Particularly, I mean, the goal is to get blood returning back to the brain as quick as possible, right? So delaying that could have, because there's what's called the penumbra, which is an area around the insult of the brain that's affected, and that swelling and blood that sort of leaks out has the ability to basically cause like permanent long-term damage. So that's the debate right now is whether or not it's safe to give this medicine to help bust the clot.
She's still in the window for thrombolytics.
She still gets ABT before one special.
What type of person is best suited to work with an MRI machine?
Technician.
Someone with a magnetic personality.
Robbie checked her out, sent her to CT.
Interrupt the hot gossip, but what about me?
You got some pretty good.
He's
Yeah, I see why she didn't like him.
a bit of a Chad.
Gotta look at your leg.
You hear that? Your dad's gonna have a cool cast.
Big Harry in the house, up top.
Tia!
Mm,
He doesn't like that.
he doesn't like Eric Estrada.
Yeah, I can see that. Amen. Mateo.
Hey,
Okay.
it's me in a acai bowl every morning.
Gift. It keeps on giving.
I already apologized for that.
That's interesting. I forgot about the ankle monitor.
Live with myself if something terrible happens.
Well, now the police are involved, so you may ruin this kid's life forever.
But you may have saved many
Yeah.
others.
I can live with this one. Now you can too.
I think there's like history there with him as to why he's being.
I don't know.
Surgery is to stabilize the bones with plates and screws so they can heal
How
properly.
long am I gonna be stuck here?
Pain medication to provide you with adequate relief. Propofol 50 of fat.
Whatever, just knock me out.
Smooth.
Handstands for at least 48 hours.
Copy that. I do not know how Dana does this every day.
Here is a Sisyphean task.
So this is a punishment.
Sisyphus. Yeah, he had to roll the boulder up the hill, and it would just.
There he goes.
One must imagine Sisyphus.
Okay.
I can't even say that.
I do appreciate the Sisyphus reference.
Sisyphus.
Sisyphus.
Is that like Greek mythology?
They want a statement from Dane.
She's in CT. Let's stay hermetically, and then she can decide when she wants to talk to them.
What about other hospitals? You let them know?
Notify. Everyone's on the lookout for this guy, Tristan.
Thanks, Bob.
Let you know the authorities are looking for this psycho, but violence against healthcare workers is a national.
No surprise, there's a nursing shortage everywhere.
Hear you. It is unacceptable.
What kind of circus are you running down?
God, you're like a bad penny.
You're like a bad penny.
She's all right. We sent her to CT to make sure.
Provide an incident report?
No, I was more concerned with her having a skull.
It's like it just happened.
I know.
Guy from the waiting room get back here without anyone.
Gloria, what a great question. Our hardworking nurses were just asking me.
Yeah.
If nurses don't feel safe, not gonna come to work.
All right. Address them.
Do you even remember the last nursing strike? You remember that PTNC is a family.
We're a family.
Come on.
Dysfunctional family.
You should be worried about the nurse.
Slowly sneaking away.
Just to borrow another term from the children, he just cooked. I think that's what they would say.
Oh yeah, just cooked her.
Let him cook
Yeah,
or let him eat. I don't know. Some kind of food.
he just got cooked, right?
Yeah, but I think cooked is bad though. I don't know. Someone.
No,
likes that.
she just got cooked.
Yeah, she got cooked.
Okay, he cooked her.
He ate. I don't know.
No, I don't think that's right.
Daughter later.
What the heck?
Yeah.
Pencil in the ear.
Driver's license and insurance card, Mr. Puglisi, and the triage nurse will call you back soon.
Thank you.
My son needs help his eye.
Let me ask you about your eye. You see the line you just cut?
Oh, that's kind of rude though.
Yeah.
I mean, oh, she cut it. I didn't know that.
We thought this was the line for pediatrics. I'm 16.
I'm doing this if you're a minor and you have manners. Name and date of birth,
Every young, December 7th, 2008.
Is his eye gonna be hanging out or something?
insurance information from your father. Take a seat.
What? Nope.
I doubt it. They would have called the ambulance.
Come around to the dental door.
Connected place on deck?
She's 62 kilos, 0.25 per kilo.
I was legit thinking his eye was gonna be hanging out.
Would you mind hanging down here for a bit? I could use your expertise on this.
I believe you had the nerve to ask.
Oh my gosh, his jokes. That took me a minute.
Yeah, that one was subtle.
Pulse ox 99, good end tidal CO2.
Hey, Chad.
I don't know that.
Oh, perfect.
Yeah, I don't know that giving propofol without an airway is typical. At least I know in my hospital that was a big no-no.
Okay.
We'll have you fixed up good as new.
What does he have that I don't have?
Talking about Mateo.
Probably.
Mateo. What's his story? Is she having sex with him?
Well, if she isn't, she probably should. Or of morphine for Zofran, excuse me.
It was easily 100 miles per hour.
Woof.
That matters. Well, I guess it kind of does, but
Slider, a .94 ERA, and he's a southpaw.
left-handed.
That's a future Cy Young.
It's the award given to the best pitcher, which ironically might go to Paul Skeens from the Pittsburgh Pirates.
Is that why he can't see?
That's part of it. There seems to be a collection of blood behind the eyeball. Hi, we have to act quickly.
Okay, well, check the pressure.
Going.
We're just gonna sit around and wait. You asked for her to explain.
Intense conversation with Robbie earlier. Everything okay?
Yeah, I'm really curious about this.
He is my attending, and I wanted his input on a patient. Is that not okay with you?
Just come to me first next time. Got it?
Could have said, please? Maybe. I don't know.
Yeah, I mean,
Is that not okay to go to your attending?
well, let's talk
You
about
might
that
think
later.
Yeah.
I was thinking about California, maybe UCLA or USC.
Hey, maybe you can go straight to the majors, huh? College can wait. Ed's got a God-given gift, man. Every weekend doing travel ball when he was young, showcases. He's not throwing away his shot at the majors.
He sounds real excited about it. The son. I kind of want to go to college. No, we're just going to skip that.
I mean, he took a line drive to the eye. He's probably not real concerned about that, about the majors right now.
This is my boy Ever. Nice to meet you both. Okay, I will take.
I was waiting for his baseball stats to him.
They're holding CT for him.
Let's take a look. Negative side. No globe rupture. Okay, go with the Tonkin.
Still?
Lift eye pressure 50.
And that is high.
So we're gonna cut a small opening on the side of your eye. In your eye. Got it? Yeah. You want to watch? Devati, step
I
up. So
see
you can
Dr. Robbie like
Dr. McKay?
in action.
Medicine here, okay? Okay. And cracker and some burn.
3 older brothers. Guess they're kind of my best friends. They kind of tortured me growing up.
Teddy's been my best friend since we were 15.
Oh.
We met in 4-H and we fell in love. Sorry.
No, it's fine. Third generation Nebraska.
Yep.
It's very kind. I need some help in here.
Is that Teddy? Oh no.
Sounds like it.
The vent showing high peak pressure, low tidal volume. Restrictive pattern?
Why is the med student the only one? Okay.
Will give us our best shot at preserving his vision, yes. Either do the honors.
Who, me?
We are a teaching hospital. Are you still here to learn?
Okay.
You can release that hemostat now.
Paper scissors.
The length of the crushed area, guide for the length of your cut.
That was the eyes. No.
This one's actually pretty cool.
No, it's not.
How can you see with all that blood?
You can. It's all tactile. Feels like 2 guitar strings.
Medicine bong. Inferior.
Yeah.
Sit down, man.
They've shown enough of this.
See if you can make him as soon as we dress the wound.
Tomorrow, Dean, tell him to prep for surgery.
Oh, thank you.
Figured after the whole Teresa thing, you might bench me.
Am I still pissed that you might be on my back? If you ever do it again, you can bet your ass that I will bench you. And teachers can still learn stuff. That's all I thought about. I did not think enough about those girls.
Wow.
Burn victims tank and we need you.
God, I can't wait for this use of yours.
Yeah, that eye scene. I can't work in healthcare. Not enough for me. You think of a story?
Well, no, it was going to be another long-winded.
Okay.
You know, I was thinking, since your dad's going to be laid up for a while, maybe you'd want to stay with me until, like...
You've gotten squeamish before, right?
For real?
Would you want to share that story?
Yeah, you could.
I kind of did, actually.
That didn't make me squeamish. It just, like, eyes.
It sounds painful.
Whitaker? He's still heavily sedated. He won't feel a thing. This is going to help Teddy breathe. So that's 83.
I want you to watch Dr. Langdon as he makes this vertical incision. Then you're going to do the exact same thing on your side and follow his instructions.
I'm sorry, I don't think I can watch it.
Yeah, I don't think you probably shouldn't. I don't think.
We get
Okay.
We got it. Probably should.
Probably shouldn't.
Yeah.
That's, not as bad to me.
Not cutting in the eye.
Okay, it's kind of gross.
Keep watching. You might.
His tissue's really popping out. Which illustrates what? The pressure underneath.
The eyes, it's a fear for me because you can't close them.
Yeah.
You have to keep it open.
For eye surgery, yeah.
Yeah.
Well, yeah, but they were cutting beside the eye, not in the eye.
Still, you see it.
Yep. Good. Looking good.
Yeah. See, I close my eyes.
Connecting the 2 incisions.
Peak pressure's already down to the 30s.
And tidal volume is...
That was wild.
Dress these wounds and send off the blood gas.
So they relieve pressure in his chest.
This guy, though, is still pretty critical. Like this is...
Yeah. So you have to cut this. It was just the skin that had contracted, right?
There was like dead tissue and there was swelling and inflammation that was building up, and it was restricting his airways from being able to completely open
Okay.
or to completely the expansion of the chest.
Your eye splinges. Miracle man. Surprise, here's a dog. Surprise. You're so silent.
Pissed in your cornflakes.
You're regretting buying that dog, aren't you?
Pogi-pogi, kaya lang Si, iwasan mo yung ganyan. Sayang lang ang oras mo. Tingin mo nag-sex sila.
Ew, naku, hindi.
Who are they talking about?
Langdon and what's her name?
But isn't Langdon's married?
Yes, I think they're just talking, gossiping.
Okay.
Great. We could really use a rock on the floor.
What's her name again?
With Collins?
Yes, that's it. Collins.
And if I give her the good news?
Go for it. And anything else she needs.
I got it.
He seems to be unraveling a little bit.
Yeah.
She wants to be in surgery. What you doing in the ER?
Question, why don't you ask your new BFF Garcia? I know that you've seen those two. I'm the only one calling her out, so she has an axe to grind. You've always said it's like playing a team sport. People trust each other. If we have one complaint, this whole place goes to shit.
Kozlowski family med, they open up their urgent care of 2 hockey kids.
Yep, Zazie fam.
Oh, she's still working.
But your CT came back clean. Think Mother Nature can't heal on her own.
For a free nose job.
Probably get hazard pay too for one.
Oh.
And before you ask, no, I never climbed into bed with a patient.
I was not going to ask that.
Just get ahead of that one.
You? No. Got a lot to think about.
Okay, well, she's also a coworker.
That is obviously.
What do you call a group of brains who form
What?
a glia club?
Oh.
A what?
A glia club.
Keep me posted if there are any.
Oh, good.
Just a neuroanatomy term.
Oh, okay.
What's with Dr. Meta and the
Jokes.
You know why they say laughter is the best medicine? Laughter releases endorphins. Endorphins help relieve pain.
That's probably why I try to make jokes when
People are
sad
dying.
scenes. Yeah.
Really like to talk to my patients about their lives. Makes them feel important.
Yeah, seems to be coming to.
Nothing to worry about unless you're concerned he still has a thing for you.
Oh, please euthanize me if I ever even consider it. But you know, if I could go back, I wouldn't change a thing. Without Chad, I wouldn't have Harrison.
You're very lucky.
Oh.
You know, right?
Thanks again.
I was getting ready to take her out when she developed angioedema.
Oh. Well, what happened to her tongue?
Angioedema.
Oh, they said that like I knew what that was. Angioedema.
Well,
Are we intubating? Are we not intubating?
Not.
Strider is improving.
Getting easier to breathe?
Future's coming back.
No, Mo. Sorry, I think Dr. Meta's rubbing off on me.
Don't forget about dinner at the farm. Make sure to brush up on your diaper changing skills.
7 nieces and nephews. I'm a diaper genie.
You know, you just called yourself a trash can, right?
Diaper genie. Do you know what that is?
no.
It's a trash can for diapers.
Oh.
Yeah.
Oh, okay. Got it.
His chance of dying in the next week is over 90%.
Oh, wow.
But he's a lot more likely to die of sepsis before his kid is born. Kiara.
Who's Kiara? Is that the wife?
I don't know.
Oh, that's the
Surgeon?
CT shows a hairline orbital floor fracture.
mental health.
Oh, behavioral health.
Yes.
They're ready for you now.
Hey, don't worry, bud. All right? He has the surgery, stays overnight, he goes home tomorrow.
On how the surgery goes and what his post-op results are like.
Is he gonna say how long until he's back playing baseball?
I think he's basically saying he wants to pitch. Like he needs to pitch soon. Right.
Yep.
Yeah.
Freaking out because he may never see out of his left eye again. No, forget baseball. Just be his dad. Gotta keep that numbered.
Oh man. So she's crashing out.
Edema responded to epi, diphenhydramine, and steroids.
Thank you. You're very welcome.
Neurotransmitter makes the best adhesive.
I don't know.
Glutamate.
Nicely done, Dr. K.
Maybe. Dr. Mohan, what about have special sauce?
Really?
You do. Just be yourself.
Of course she has special sauce. She's Mel.
I know. Well, she's already showed it several times.
I know.
Do we think you needed to chill out a little bit? Parent, this might be his way of coping with the stress of food. Sorry, I don't know what came over me.
Your mom.
I think we all do.
You and that baseball kid are two pressure cooker prodigy. Physicians, we gotta learn to keep our emotions in check. All experiences interfere with our professional responsibilities.
Dr. Robbie that a little bit. He needs to line that.
Yeah.
We also learn to never get on your bad side.
Yo.
Mateo.
Every once in a while to make sure he's not burning the place down.
Can do.
A new foot massage place just opened in the strip district.
Okay, cool. I'm play Sunday.
Yeah, whatever, wherever. I mean, Harrison would love a sitter closer to his own age.
Oh. Closer to his own age.
So, how's your first day going?
Kind of forgot it was her first day.
I know.
Regardless of personal relationships, everybody on my team is doing okay. Are you doing okay?
It's not a big deal. I can handle it.
Handle what?
Nothing. It's fine. I don't want to get anyone in trouble.
I need to know about it, and you have a responsibility to tell me.
Oh, she maybe have confirmation. Whatever that is means something.
Whatever what means.
Those two pieces.
Oh, I don't know. Maybe
Yeah.
just tampered with.
It can make it look like an accident.
You can take you up on that.
She still has handcuffs on.
Are you sure?
Yep.
Oh, okay.
Yep.
Go check on Martin.
For you, boss, I got 2. What's up?
Oh.
I told you, she is trouble.
Have you ever taken a patient's medication? They need you to open your locker.
Yeah, right. You're gonna regret your
Print code on these pills gonna match Louis Librium. Go home, Frank.
No, it's not like you think. You remember whenever I helped my parents move, I was too cheap to pay for movers. I hurt my... I'm sorry. I was trying to... I don't understand. I don't understand. It's not like you think. I'm not high. Could a drug addict do what I do?
Yeah. Just because you're not living on the street doesn't mean you don't have a problem.
Yeah.
Leave now, or I will have Ahmad escort you out.
Robbie, please.
You are done.
That's hard.
Yeah.
I mean, like, not only is he dealing with everything, all this other chaos that's going on, and it's over.
That's it.
What?
And that's how we're gonna.
Okay, so that must be what that person that commented and said. It all makes sense.
Yeah.
Okay.
Well, I think the writing has been on the wall for a few episodes. And so it seemed like this was a likely, I don't know, conclusion. Jinx gonna be a Coke, but
the quarter.
What? I thought it was the Coke.
The quarter. The Jinx machine is out of order, right? Wait.
Or now I'm all up to see. Anyway, give me a Coke and a quarter.
Yeah, I don't know. There's something like a. I don't. Oh my god.
Anywho,
we're not taking benzos.
That's all. I promise.
I actually don't even know what that is.
So benzodiazepines, Ativan, Xanax, Klonopin, Valium.
Okay.
Very, very popular medications because of their euphoric effect, their sedative effect. They make you feel good. We don't know if it's just benzos, if it's narcotics, and there was all the Librium is a benzodiazepine, so that was what was alluded to there, Dr. Robbie. Well, I mean, if you get used to anything, you can
build a tolerance.
Yeah, I mean, you can function pretty well. I mean, some people, they take it, they're in bed for the day. Some people, they take it, doesn't do anything. And well, not that it doesn't do anything, but it doesn't like significantly affect and or impair them. So obviously, Dr. Langdon has not been quote impaired with his job, so far as we can tell. But obviously, that is extraordinarily illegal to do. And without getting like too much in details, I actually do know of a case where that was done in a hospital that I was affiliated with by a nurse, actually, who was keeping some for herself. I wonder how often that happens. I mean, I don't know. It's probably pretty hard with the way that things are, recorded and registered and all that. But I mean, clearly it happened here. So anyway, that was the big issue of this episode. And then, I don't know. I mean, I did write down a couple of things, but any thoughts that you have?
No, I'm glad we have a conclusion on that. It was. I felt bad for him, though. Yeah. I really did. You could just see the desperation.
Yeah.
In him, like, let me explain. Like, it doesn't. There's no explanation that would.
Well, that's that.
Taking it from a patient.
Yeah.
Like that right there, and then using it while you're working.
Well, and then not only did because if you recall, Santos had to give like significantly more than probably she should have had to. So like it couldn't have absolutely disaffected a patient.
Yes.
So it wasn't like a, I guess, quote, victimless crime, but anyway. So yeah, we'll see how the rest of this shift goes now with one man down. A couple things I think. So they've touched on this a few times. This episode really hit on it. The violence against healthcare workers. That's been it's like since the beginning of time, right? Like healthcare workers, it is a difficult position to be in because sometimes you are dealing with patients when that obviously these patients aren't at their best, right? Like they are in pain. They're usually, in some cases they're altered. And so that can be hard, right? Let's say you have somebody who has dementia. They don't know where they are. They think you're assaulting them, right? So like they're fighting back. So where does the line drawn in terms of, how much grace do you give an individual in a situation like that? I don't know the answer, but obviously violence against healthcare workers is something that is a big problem. I know you asked me a question if I'd ever been assaulted. No, thankfully I've never been assaulted, although I have been threatened.
Yeah.
And so that's also not good.
Yeah.
And I think if I remember correctly, there was something about the actor's name, Dr. Robbie. No Wiley.
Yeah, I was say I forgot it.
When he gave like the speech, the acceptance speech for the Emmy, I think had brought up like violence against healthcare workers.
Oh.
Something he really touched on.
And it's not that like in a lot of times, sometimes, well, not this guy that punched the charge nurse, but Sometimes there's, like you said, there's some mental health issues. They're altered, they're in pain. Doesn't make it okay, but there needs to be things in place that prevent the healthcare worker from being attacked.
Yeah, I think you have to develop a system that doesn't subjugate, is that correct word? Doesn't expose.
Sure. Yeah. Like, I mean, that guy was escalating and had multiple times.
Right.
Security probably should have gotten involved way sooner.
Well, and Dr. Robbie kind of turned the nurses onto the administrator there because he brought up the fact that he'd requested additional security support, additional safety measures that were denied because those things cost money. And then obviously the consequence sometimes is this. So I think that's what it's really getting at. Like, if you identify a problem, I do think it is the system's responsibility to address that. And that sometimes means that you're going to have to invest money into a problem that has no return on said investment, rather than say maybe happier staff, which they alluded to that too. Happier nurses feel unsafe. They're leaving the profession in droves.
Yeah.
We're in the sort of, I don't know if we touched on this in a previous episode, but we did touch on it on the podcast. You're entering this crisis of healthcare where our ability to keep up with the demand of patients needing care is not, we're really going to struggle with that. And it doesn't help when healthcare professionals are leaving the profession because of things like that, though. Anyway, obviously that was a big theme of this episode, and I think they've touched on it several times already. You had asked a question about, was it right for Santos to go to Robbie?
And
not to Langdon. So this brings up the concept of chain of command.
Yes. And I'm not saying, I know in this situation, she was concerned about a drug issue with him. I know that's I meant more in general.
Yeah, like let's say you have a question about a patient.
Yes.
Yeah, so this is a good question. I think it's, there's not like a hard and fast rule about this, but in medicine, there certainly is a hierarchy of training, right? You have your interns, you have your residents, you have your seniors, you have your chiefs, and you have your attendings.
She's an intern.
And she's an intern. Yeah. So she would be at the, quote, low end of the proverbial totem pole. But it's, so we would generally, so like, I don't know if I've shared this at all, but like I was a chief resident for a year, and part of my obligation was policies and procedures, and sometimes that even included disciplinary action. Thankfully, I had great interns, I had great residents. There wasn't anything that really escalated too bad. There kind of was, but it's probably not something I should share. Anyway, so I feel like we kind of keep teasing.
I know.
Sorry.
But there's sometimes things you can't talk about.
Yeah, some things are borderline legal like issues. But so the point is, keep teasing. Going back to that, we would encourage, like, say, interns to follow up with their immediate supervising guys. Just because there's a chain of command doesn't mean obviously that individuals are any less valuable, right? Like, that's not what we're trying to say. Kind of to Robbie's point, it's a team. We're all in this together, not to sound cliche. But yes, we would probably prefer you take kind of those immediate concerns up with your supervising resident and or senior resident, and then chief, and then attending, and then, or in a residency program, maybe, program director, associate program director. So yeah, there is a chain of command with that. Now, if the issue is with your direct supervising resident, then you do have to go above them.
Right.
And so that's appropriate. So I don't see anything, if it was purely asking like a medically based question or a patient related question, yeah, that probably should have been taken up with Dr. Langdon.
Yeah. But
the situation here was very different. So no, there wasn't anything wrong with what she did, in my opinion.
Yeah.
And then you asked about if I ever got squeamish.
Oh yeah.
I think I actually did share this with one of the episodes here, but it was just the only time I ever kind of felt squeamish was twice. Once was when I was observing. It was actually before I was even in medical school. I got to go into a pacemaker, like they were the electrophysiologist, the cardiologist putting in a pacemaker, and I was watching it. It was really cool, but as they were like cauterizing the skin, I got like a strong whiff of that smell of burning skin. First time I'd ever smelled that. and the room got real hot real quick. And it was like, hold on. So I actually walked out because I was like, last thing I'm going to do is faint here. So I did walk out of the room. That has never happened. That had never happened again. I've been smelled that smell now.
Maybe you just didn't breathe in as deeply.
I think it was just caught off guard.
Yeah.
And then the second time was when I was a med student, and I think I shared this story, but it was kind of the first time I witnessed somebody in like real legitimate pain. And it was hard because, I don't know, I guess it's just maybe that it was kind of empathetic, or you
felt like you felt it.
Right. And it made me feel really uneasy. Now this is going to sound bad, but thankfully I have come to, like, I can witness people in pain now and not feel that way.
Yeah.
I'm not trying to, it's not that I like them being in pain, but that was also kind of a one-time thing, and it was really uncomfortable. So I left the room there too. I was a medical student. It was a whole group of us in a room with a patient. I left the room, got a drink of water, came back. The attending was like, "You okay?" Like, yeah, I'm good. I'm good. At least had to get, my throat was dry. So we're good. All right. Anyway, I feel like that was a lot of rambling. I guess episode 10 in the books.
Yeah.
Much less sad. Lucy? I don't think so.
I feel like you're challenging her.
We'll see. I'm partly expecting there to be some. I mean, she wouldn't have said that without reason.
I know.
So we will see, but I don't know. I still have a hard time imagining anything worse than that, what we saw.
Stop talking about it.
Yeah. All right.
Okay.
Anything else from you?
No, it was a good episode.
Right.
I actually, wait, real quick.
Yeah.
I think these episodes are getting, they seem to be going quicker and quicker. Like, they're over so quickly.
Or I guess you're saying because you're like more drawn
invested.
in.
Yeah.
Yeah. Because I think the actual duration of the episode hasn't changed.
I know that.
Okay,
I'm just saying they just feel so short. Like, oh, wow, 30 over.
And we're
Okay.
done.
Yeah.
All right. Well, getting ready for episode 11. So feel free to come back and check that out with us. Again, guys, thanks so much for being here. We'll talk to you soon. Good night.
See ya.
I am Dr. Todd.